There are several testing sites across the metro, but are all tests for COVID-19 created equal?
I didn't feel confident. We got our negative results, which, that was good.
Many test sites across the metro are having people swab themselves for the virus.
But are the results as accurate as tests performed by medical professionals? 41 Action News investigator Jessica McMaster finds out.
This is how medical staff test for COVID-19, but could you perform the same test on yourself? We asked several people in Kansas City.
No, I don't think I could.
I do not know how anybody could do that on their own.
We received a similar response online. Lori Kerr says, I had a COVID test tonight and they did it. No way could I do it, let alone accurately. 3 weeks ago, Cayman Tatum got tested after a possible exposure to the virus. His mom, Amy Pinkerton, performed the test on her son at a drive-up site that offers self-testing.
It wasn't that bad. It kind of hurt.
Pinkerton also tested herself.
I didn't feel confident. We got our negative results, which, that was good.
Pinkerton says she doesn't think she went back far enough with the swab on her and her son. A couple weeks later, Tatum got sick, so back he went for more testing. This time it was performed by a nurse.
Probably the worst thing I've ever done.
And I watched his reaction and he was like coughing and gagging.
Turns out the two tests may have been different altogether.
The nasopharyngeal is the gold standard.
The nasopharyngeal swab is the test the nurse performed on Tatum, where the swab goes all the way back. St. Luke's Assistant Director of Prevention Infection, Ginny Bose, says there's also a nasal swab that gets inserted just inside the nasal cavity, which could be the test Tatum and Pinkerton self-swabbed with.
A nasal swab doesn't go as deep, and it's also a legitimate test.
A small study from Stanford took 30 patients who were tested by medical staff with the nasopharyngeal swab. The group was then asked to perform their own nasal swab. 29 of the 30 participants got the same negative or positive result.
The specimen collection process is an integral part to getting good results.
Bose says while the nasopharyngeal test is the gold standard, the results ultimately come down to one thing.
It really just comes down into people following the instruction.
Here's what an instruction sheet looks like. As you heard her mention just now, it is important that you follow these instructions to a T if you want to get accurate results. Both Tatum's tests came back negative. I'm investigator Jessica McMaster, 41 Action News.